Abdominal aortic aneurysm is abnormal dilation of abdominal aortic wall. Now, what happens? Let us look at the normal anatomy of abdominal aorta. Let's suppose this is heart, and from left side of the heart arise aorta, and the aorta and abdominal region is abdominal aorta. Now, what happens? There is aneurysmal dilation of the abdominal aortic wall occurs, and that is abdominal aortic aneurysm. So it is abnormal dilation. Risk factors are male, gender, family history, hypertension, hyperlipidemia, and smoking. It is most commonly vascular related disease. That's why those conditions which create harmful effect on vessels give rise to abdominal aortic aneurysm like hypertension, hyperlipidemia, and male gender. So, clinical features of the abdominal aortic aneurysm will be those patients who are median age like 65 years, elective cases, and 75-year in emergency cases. Usually, patients are asymptomatic and found incidentally. Central abdominal pain is present in these patients with abdominal pulsation and palpation of abdominal aorta. Complication will be rupture and thromboembolic ischemic event can be there. Rupture of abdominal aortic aneurysm can happen, and the collection of fluid and blood can occur, and that's why the complication can develop. Diagnosis will be contrast CT scan, abnormal ultrasound, and management will be asymptomatic patients of abdominal aortic aneurysm should be uh, uh, greater than 5.5 centimeter, and then there should be distal embolization with mode of repair should be also done with endovascular aneurysmal repair or open surgery repair, and there are certain surgical choices for repair of the abdominal aortic aneurysm. Another disease of aorta is aortic dissection. Now it is aortic intimal tears which results into extravasation of the blood into aortic media, and then splits into two layers creating false lumen. Pseudo lumen is also created. Now let me show you the aortic the dissection of the aorta. Now look at here, this is the normal wall of the aorta, but here you can observe that there are two walls. One is this one and another is this one, and the difference between two walls is the media. So blood is collected here. Now this is normal original physiological wall of the aorta, but because of certain pathological factors there is abnormal wall is created, and between both of these walls of aorta blood is accumulated, and that condition is known as aortic dissection. Risk factors of aortic dissection are hypertension, aortic atherosclerosis, aortic coarctation, Marfan syndrome, Ehlers-Danlos syndrome, fibromuscular dysplasia, pregnancy trauma, and iatrogenic causes can also be there. Classification of aortic dissection are different types: stand for A, stand for B, DeBakey 1, DeBakey 2, and DeBakey 3. So these are the classifications of aortic dissection, and the clinical features are: in men it occurs more common as compared to women. Peak incidence occurs in 6th to 7th decade. Pain is present in chest, sudden in onset, and in descending aorta the pain will be in interscapular pain, and it is severe in condition. Syncope will be there, congestive heart failure, cerebrovascular accident, hypertension, hypotension, shock, asymmetrical pulses will be also failed. Diagnosis will be on the basis of chest X-ray shows mediastinum widening, distorted aortic knuckle, and transesophageal echo will also be performed. CT and MRI angiography is highly specific and sensitive for aortic dissection. Treatment for type A will be dissection is required for emergency surgical replacement. Type B is treated medically, and targeted blood pressure should be maintained in between 60 to 75 millimeter of mercury. Keep systolic blood pressure 100 to 120 millimeter of mercury. So control with IV beta blockers, and there should then decrease the systolic blood pressure, and IV vasodilator should be given. Nitroprusside should be given along with the calcium channel blockers, but these are contraindicated. Calcium channel blockers are contraindicated. Rarely verapamil can cause or diltiazem can cause contraindication. So these were the disorders of the aorta.